much, Lasky Curla. I'd like to thank Sinn Féin for putting down this motion. I partially heard the Minister's response to it, and I have to say, from what I heard of it, it was slightly surprising in that he on the one hand, accused Sinn Féin of playing politics with the situation and not going with the clinical advice, and on the other hand, it appeared to me overruled the clinical advice and said that they weren't going ahead. And I bring this up because Limerick has been cited on a number of occasions and what can go wrong. And I suppose, like, the clinical advice at the time was, well, we need to consolidate the provision of emergency medicine at Limerick University Hospital. And that was what was done. But now, on the 15th of March this year, there was a surprise visit by HIQA. Not the first surprise visit, there was a surprise visit, I think, back in 2014, since that consolidation of emergency services was done. And a damning report was provided by HIQA back then. Not a lot, or rather a lot has happened since then, in fairness. A new emergency department has been built, kitted out, staffed. And there was a surprise visit to the emergency department in UHL on the 15th of March this year. And notwithstanding all of that, not a lot had changed. A very damning report was and I see the Minister nodding in agreement. I mean, obviously, I haven't heard the Minister comment on it yet, but I expect that I will. But more than commenting on it, I do expect to see something happen at UHL, because it is simply inadequate. I just can't put it any further. I've accompanied relatives in there, elderly relatives, vulnerable relatives, and I, like many people across Clare, you pray, you hope that they won't have an accident, that they won't be brought there, that they won't end their days in there. Because it's just, the HIQA report even, you know, they failed on providing dignity to patients. Everybody wants dignity as a patient, but especially to an elderly person in their last moments. They want dignity, and it's not being provided there. You know, an ambulance, I had an elderly relative who had a fall in a healthcare setting, and an ambulance was being brought, and I begged them not to bring an ambulance. And actually, I had to sign forms and stuff so that they weren't brought to UHL. And instead, I bundled that person who had lost their mobility into a car and brought them to another healthcare setting. And thankfully, they received the care they needed, because if they were brought to UL, they would have sat in a wheelchair or sat in a trolley in overcrowded conditions, with, of course, the attendant risk that they're going to get an infection. This was pre-COVID, with the attendant risk that they're going to get an infection, because, you know, hospitals are places where inevitably, despite the very best efforts of everybody, people are sick in hospitals. So if you're there waiting for a long period of time, you have an increased likelihood of encountering at least an infection. Now, obviously, that's not something that would worry me terribly from myself, because at least I hope I'm reasonably healthy. But, you know, when you have an elderly person whose immune system is inevitably compromised by the conditions that beset them, well, it's a different environment. So, like, it is not safe. And now this is being vested upon the people of Navan. Now, I don't know whether the A&E unit in Navan is perfect. It's probably not. I mean, I know that the clinical director has recommended that the move take place. But for God's sake, let that move not take place until there's adequate and sufficient capacity in Drogheda. And I heard TDs who represent Navan say that, and I've heard TDs who represent Drogheda say that. I heard Jed Nash talk about Drogheda. Because that's exactly what happened in Limerick. I mean, if you read the HIQA report, and I'm not going to recite it, I mean, I know you've read it, but they talk about circumstances such as the hospital being the only Model 4 hospital in the Midwest region, combined with the hospital experiencing unprecedented numbers of presentations of COVID-19 and non-COVID cases to the emergency department. So one of the factors, and it's something that they repeat throughout the HIQA report, is the fact that it's the only Model 4 hospital in the region. You know, I do appreciate that clinically it is recommended that, you know, A&E consultants and A&E doctors and nurses have to see a large number of patients to keep their skills up, so that, you know, and it is not considered best practice to have small ED departments where there are small numbers going through. I appreciate all of that, but nor is the alternative which we've put in place in Ireland, which is UHL, best practice either, because it was found that the levels of overcrowding there, and it's not a once-off, it's a consistent level of overcrowding in UHL, poses a risk to patients going in there. Now, it's not that the staff in there are reckless or that they're not doing the very best that they can in circumstances, but it's simply that it does pose a risk. So while, yes, there's a risk for patients to be in a small emergency department like Navan, like Ennis when it was there before, there's equally a risk when the alternative is massive overcrowding. And Minister, I just want to know what is going to be done about Limerick, because I asked, was the Taoiseach going to take responsibility for remedying this into his department? And if not, what was going to be done to ensure that the situation in UHL was going to be remedied? And I know he's not here to defend himself, but you know, you are his Minister for Health, and Minister Butler is also a Minister in the Department of Health. So either of you can defend him, but his response was highly disingenuous. He said that the HSE is responsible for the delivery and operation of health services. The capacity is simply not there for any department, including the Taoiseach's department, to begin to run hospitals. Now, I wasn't for a moment suggesting that the Taoiseach go in there and manage UHL, or that either of you ministers go in to manage UHL, or anybody in the Department of Health manage it. What I was requesting is that a commitment be given to provide the resources required to bring the capacity up to what is needed, because that HIQA report talked about the lack of capacity in UHL throughout, and that management be put in place that can manage the existing capacity, because that was the other part of that report. And the part of the report which is as worrying to me is the damning indictment of the current management that is in UHL. And it is an indictment of them. It doesn't give me any pleasure to say that, but it is. And to hear them coming out talking about the clinical director giving nonsense in the airwaves, an insult to people whose family members are in there, an insult to people who contact me and every other TD in the Midwest region to complain about what's going on there. An insult to HIQA, the people's common sense, the excuses. I mean, they're excuses that you'd say were pathetic from a politician, much less from a clinical director of a Model 4 hospital. I'm sorry, but they are inadequate. And if they had a shred of honour, they'd be falling on their swords after a report like this, because it is not good enough. And if as a clinical director you cannot stand over the standard of healthcare being provided in your hospital, then surely you have a duty to highlight that publicly and walk away if it's not addressed. But neither is happening at the moment. There seems to be a collusion between management in UHL and the HSE and the government, where they'll pass the buck, they'll blame one another and say, well, it's not my problem that the government didn't give me capacity, it's not my problem that UHL management aren't doing a bit better, it's not. But ultimately, it is my problem. It's my constituents' problem. And I am one of 160 people who can vote for a government here. So, I mean, there has to be, the buck has to stop somewhere. And if it doesn't stop with the Department of Health, if it's not their problem, well, then, Minister, it becomes your problem at some point, because you are democratically accountable to us, 160, 59 others apart from yourself, and we are democratically accountable for the provision of government services in our areas. And I don't want to personalise it, because you didn't create the problem in UHL. I know that. If you could fix it, maybe you could actually manage it. You are, after all, somebody with management experience, but you have another job, and that's to be Minister for Health. But it is your responsibility, it is your government's responsibility to put management systems in place to make sure that the existing capacity is properly utilised, and it is your responsibility to ensure, subject to the availability of national resources generally, and it does seem that UHL is under-resourced compared to comparative hospitals around the country, and healthcare generally is under-resourced in the Midwest compared to other regions. It is your responsibility to put resources in place to have a decent standard of healthcare. And I'll be voting with the opposition on this because I don't want to see... there's a slim likelihood I'll ever end up in hospital in either Navan or Drogheda, but I don't want to see anybody witness the chaos that I have witnessed. I don't want anybody to be afraid that their relatives will be brought to hospital. It's unnecessary, given the resources that we have at our disposal in this state.
Thank you.